Hello, everyone. In this section, we're going to discuss mood disorders. And so this is also sometimes called affective disorder. In psychology, affect is another term for like emotion. So when we're talking about these types of psychological disorders, the most common type is then depressive disorders. So, much like with anxiety, there we can think of this being along a continuum, and there is feeling sad, and especially when there's a reason to feel sad. A loved one passes away, you lose a job, you do really poorly on something. Um, these are very normal emotions that you can have, but we can have things that go beyond this, that can then rise to the level of a psychological disorder. So, depression affects about 7 to 8% of Americans each year, and 1 to 6 people will experience depression at some point in their life. So, major depressive disorder is is where you have your severely depressed mood, or you have a loss of interest in normal enjoyable activities, and this is going to last for around at least 2 weeks. And once again, it's not about like just feeling sad. It's something that affects your whole life. It can affect your sleep, your appetite, your ability to concentrate, how you think about life. Your values, about how you value yourself. All these things are like fundamentally changed. Um, a person who's experiencing a major depressive episode. Another way that we can, another type of depression is persistent depressive disorder. And so this is a more kind of mild to moderate depression, but it lasts for 2 weeks to years. Um, and so these individuals may be able to function kind of day to day, but their life often feels like it's like this constant uphill battle that they're having to deal with. I think this image, it kind of illustrates this well. You can see the difference of the idea of like a major depressive disorder is kind of this intense depression for a more limited period of time, as opposed to persistent depressive disorder, which is more just a constant uh, lowering of mood. And you can also kind of look at this chart to kind of also get a sense of that continuum, from extremely depressed to extremely elevated, which we'll talk about later with bipolar. So depression has many causes with it, and we often look at it through the biopsychosocial approach. So biologically, we know depression runs in families. If we look at twin studies, that we can see that genetics accounts for a significant portion of people who are at risk. And if we are looking at the brain, we can see that there's certain areas of the brain, like the prefrontal cortex, that maybe is underactive in people with depression. We also see alterations in things like serotonin signaling. But that's only kind of one part of depression. So if we're looking at the psychological factors in depression, um, you can Aaron Beck kind of uh, conceptualize this idea with the cognitive triad. When I'm referring to like negative thoughts, thoughts of the self, that I'm worthless, thoughts of situation, the like the world is unfair, or thoughts of the future, things will never get better. And so that's one kind of way that that cognitively that can be framed around a person who has depression. And then we've also talked previously about the idea of learned helplessness. When people experience repeated failures or traumas, they may begin to believe that they just have no control. Even when they actually do have control over something, they feel like they don't. They've learned that they don't have control. And so this mindset leads to people being passive, apathetic, and all those things can like worsen depression. So this is kind of a diagram, kind of uh, looking at that cognitive triad of the conception of self and the situation and the future. And then we have the social cultural factors that go into depression as well. Across different countries and cultures, women are twice as likely as men to be diagnosed with depression. And you know, some people have speculated that women are more likely to internalize stress, leading to depression, anxiety, while men, in contrast, are more likely to externalize their stress, and so they might turn to things like alcohol or aggression or risk-taking behaviors. Um, there's also recognition that social media can play a role in this. Stigma and isolation also kind of all play roles, especially when we're looking at mental health of younger people. So, how do we treat depression? So, one very common way of treating depression is the use of medications. Um, the first line is usually something like an SSRI, a selective serotonin reuptake inhibitor. Your kind of your Prozacs and Zolofts and whatnot. These drugs work on the serotonin systems in the brain, and they tend to have fewer side effects than some like kind of the older medicines that exist for the treatment of depression. Some which has some very severe side effects from them. But this isn't the only option that we have for the treatment of depression. So cognitive behavioral therapy, the research has shown this over and over, is just as effective as medication for many people. CBT works by helping people to challenge distorted thinking patterns, like believing that you're a failure after just one mistake, and replace them with more realistic and helpful thoughts. And when you combine the two, when you can do both CBT and medication, then this is, for some people, this is actually where we have see the kind of the best outcomes for that. Now, as I mentioned in the other unit, there are some other more evasive treatments for the treatment of depression. One of those being electroconvulsive therapy, ECT. And as I said before, there's a strong stigma surrounded it. But when you have really severe cases, when a person is at imminent risk of their life, this can be a very effective form of helping to alleviate symptoms, so that then there's time for other things to have longer terms effects. A lot of the side effects that from early times were due because when they induced the seizure with the electrodes, a person would stop breathing, and that could then damage memory systems. And so today they do it under anesthesia with muscle relaxants and maybe a respirator. And, it's done in a better way than it would have been done decades earlier. That being said, it is absolutely a treatment of last resort. Another thing that's become more popular is transcranial magnetic stimulation, because this is non-invasive. You go to a doctor's office, they put this magnetic device on the side of your head, and they stimulate different areas. There's kind of mixed evidence. Some people see a lot of improvement, other people don't. but it is much less invasive than these other options. And then deep brain stimulation. This is brain surgery. This is implanting electrodes in an area of the brain, and then implanting something kind of like a pacemaker. But not a pacemaker, but that same type of concept where something's kind of implanted in the chest, and then a wire's run to part of your brain, and that it stimulates those areas. And this is if unless the regulations have changed recently, like insurance doesn't really cover this because the evidence is like it works for some people, and there's certain cases where it works well. But it only works maybe about half the time. So it's a very expensive procedure that you would probably have to pay out of pocket for to get. So it really is for situations where there's not any other options. So another psychological disorder that falls in this category is bipolar disorders. And this involves extreme fluctuations in mood. So with bipolar 1, people experience these manic episodes. So a manic episode is this periods of extreme elevated mood. They're very active. Their thoughts are racing. They do risky behaviors. They go out and they max out their credit cards, and they repaint their house, and they start writing their novel. They feel all the energy in the world. Sometimes these can be scary levels of these kind of manic episodes that person can have. In bipolar 2, the highs are kind of less intense. They call it hypomania. But the depressive episodes can be more severe with it. So when you see bipolar, you have these manic phases that are followed by a depressive phase. So you kind of have this cyclical kind of going back and forth. And so when you're looking at bipolar 1 versus bipolar 2, it's kind of the extent of the manic phase versus the extent of the depressive phase. So there's a strong genetic basis for bipolar disorders. So if a close relative has bipolar, your risk is significantly higher. This is something that usually begins in the late teens or early adulthood. We see a roughly equal representation of men and women. And around 3 to 4% of the population will experience a bipolar disorder sometime in their lifetime. However, even though there's like this kind of like strong genetic link, it's not caused by like a single bipolar gene. Like there isn't like one thing that makes you a risk factor. Instead, this seems to be more of a combination of genetic and environmental factors that go into if a person develops bipolar disorder.